We have Dr. James Hawley of Southeast Texas Medical Associates joining us now for our Healthy Living segment. Dr. Hawley, of course, we're seeing all the For Your Health reports, and we're looking on CMS website as well, the results of a study released actually last week, and it's called Medical Home Feedback Report. Can you tell us about that report?
Yep.
Can you tell us more about that report? Don't worry, you're not too wordy.
That's always fun. By the way, I first want to tell you that we just finished our Hurricane Irene. That's my mother's name. And now we've got Marie, which is my mother-in-law's name.
Right.
So Irene and Marie in 1 year, maybe more than any of us can handle.
Oh, a little too much. A little too much, maybe?
CMS, which is the Center for Medicaid Medicaid Services, hired a company called RTI International to do a study on 312 medical practices that are designated by the National Committee on Quality Assurance as medical homes. They were very interested in knowing whether quality outcomes, processes, and costs were different in those practices that had elected to seek that accreditation. Then they, against a benchmark that was developed by a computer model, they measured each of those 312 practices, the benchmark, and then the average of the outcomes for each of the metrics that were looked at for the medical home practices. They were looking at, and I want to really read this because I want to get it right, the things they were looking at was quality of care, coordination of care and continuity of care, annual payments for everything, annual payments to physicians, and potential avoidable payments based on a number of different categories. And this was an avoidable cost by limiting care or rationing care, but avoidable costs that were not required by quality of care and that could have been saved if better care had been offered, had been given. Okay,
and are all practices, are they evaluated like this?
No, there are currently a couple of thousand out of 256,000 practices in this country. There are a couple of thousand that are designated as medical home.
Okay.
You can look for all three of these reports on our website under In the News. It's really fascinating. This is the first time any medical practice has ever known what is the care, the actual cost of care they're giving to patients, particularly Medicare fee-for-service patients. You know, we take good care patients. Our quality metrics were off the wall. We outperformed the benchmarks and all the other medical homes. When it came to cost, our costs were lower than all the benchmarks, which are the average typical practice that's undisciplined, and were as good as the medical home practices. Our safety issues, quality issues, improvement over time. The whole idea is that when you're practicing those things we call medical home, coordinating care, making certain that patients understand how to get their care, you're doing medication reconciliation, making sure they're on the right medications, making certain that they get their care in a timely fashion, they're getting the preventive care and so on, that it will in fact reduce the cost while improving the quality. What we've got to lose in our mentality in this country is that excellence and expensive are the same thing. They're not synonyms.
Okay.
You can get better care at lower cost than you can sometimes with very high cost of care, which actually is not better quality of care.
And that's what CMS is trying to do with
That's
all that
exactly what we're doing. 31 months ago, we started on this pilgrimage to become a medical home. Tomorrow night in Houston, I lecture. Next week in Washington, then in New Orleans, and then back in Washington the following week, and then in San Antonio on these subjects with other physicians who are attempting to transform healthcare in the United States, which is CMS goal.
Great. Thank you, Dr. Hawley. We always appreciate that. And, of course, good luck on your speaking engagements and your lectures.